Order! Before we proceed with the Secretary of State's statement, I would like to remind honourable members that the conduct of another member should not be criticised on the floor of the House other than by a substantive motion. I now call Secretary of State Matt Hancock to make a statement. Secretary of State.
Thank you very much, Mr. Speaker. And with permission, I'd like to make a statement on coronavirus. The virus is spreading both here and overseas. In the last week, over 450,000 people tested positive for coronavirus in Europe, almost double the number of cases a month ago. And here in the UK, the number of hospital admissions is now at the highest it has been since mid-June. Last week, the ONS said that while the rate of increase may be falling, the number of cases is still rising. Yesterday, there were 12,594 new positive cases. The rise is more localised than first time round, with cases rising particularly sharply in the northeast and the northwest of England and parts of Scotland, Wales and Northern Ireland. Now more than ever, with winter ahead, we must all remain vigilant and get this virus under control. Mr. Speaker, I now want to turn to the operational issues on data publication and the future plans for medicine licensing, and of course the announcement of 40 hospitals made by the Prime Minister on Friday night. Mr. Speaker, I want to take the first available opportunity to set out to the House the technical issue around case uploads discovered by Public Health England on Friday evening. This is an ongoing incident, and I come to the House straight from an operational update from my officials. On Friday night, Public Health England identified that over the previous 8 days, 15,841 positive test results were not included in the reported daily cases. This was due to a failure in the automated transfer of files from the labs to PHE's data systems. I want to reassure everyone that every single person who tested positive was told that result in the normal way, in the normal time frame. They were told that they needed to self-isolate, which is, of course, now required by law. However, these positive test results were not reported in the public data and were not transferred to the contact tracing system. I want to thank colleagues who've been working since late Friday night through the weekend to resolve this problem. And I want to set out the steps that we've taken. First, contact tracing of these cases began first thing Saturday. We brought in 6,500 hours of extra contact tracing over the weekend, and I can report to the House that as of 9 a.m. today, 51% of the cases have now been contacted a second time for contact tracing purposes. I want to reassure the House that outbreak control in care homes, schools and hospitals has not been directly affected, because dealing with outbreaks in these settings does not primarily rely on this particular PHE system. Second, the number of cases did not flow through to the dashboards that we use both for internal and for external monitoring of the epidemic. Over the weekend, we updated the public dashboard, and this morning the JBC presented to me their updated analysis of the epidemic based on the new figures. The Chief Medical Officer has analysed that our assessment of the disease and its impact has not substantially changed as a result of these data, and the JBC has confirmed that this has not impacted the basis on which decisions about local action were taken last week. Nevertheless, this is a serious issue which is being investigated fully. I'd like to thank Public Health England and NHS Test and Trace, who've been working together at speed to resolve this issue, and I want to thank everyone for their hard work over the weekend. Mr. Speaker, this incident should never have happened, but the team have acted swiftly to minimise its impact, and now it is critical that we work together to put this right and to make sure that it never happens again. Mr. Speaker, another important area of our coronavirus battle plan is treatments. As the House knows, the only treatment known to work against coronavirus was discovered here in the UK. And as we leave the EU, I want to use the opportunity to improve how quickly we get new drugs to patients here. So the UK is joining with Canada, the United States, Australia, Switzerland, and Singapore in Project Orbis, which will allow international regulators to work together to review and approve the next generation of cancer treatments faster. This means pharmaceutical companies can submit treatments to be reviewed by several countries at the same time, so we can cooperate with the best medical regulators in the world and make approvals quicker so we can get patients the fastest possible access to new drugs. This is an exciting development, and we'll join this scheme fully on the 1st of January after the end of the transition period, because we'll stop at nothing to bring faster access to life-saving treatments on the NHS. Mr. Speaker, we're investing in our hospitals too. And 2 weeks ago, I announced to the House that we're investing an extra £150 million in expanded capacity in urgent and emergency care, so hospitals have the space to continue treating patients safely in the pandemic. On Friday, I'm delighted that my right honourable friend, the Prime Minister, set out the 40 hospitals that we'll build by 2030 as part of the package worth £3.7 billion, with 8 further new schemes invited to bid for future funding, also to be built by 2030, including mental health facilities. This is the biggest hospital building programme in a generation, and the investment comes on top of an extra £33.9 billion a year that the government will be providing to the NHS by 2023-24. We passed that into law right at the start of this Parliament, Mr. Speaker, and these 40 new hospitals across England will support our mission to level up our NHS so even more people have top-class healthcare services in their local area, and so we can protect the NHS long into the future. Finally, Mr. Speaker, it's critical that our rules are clear at a local level so that the public can be certain of what they need to do to suppress this virus. And I'll update the House in due course on what action the government's taking so we can have more consistent approaches to levels of local action working with our colleagues in local government. For now, it's essential that people follow the guidance in their local area, and if they need to check the rules, they can check on their local authority website. Mr. Speaker, history shows us that the battle against any pandemic is never quick and never easy. It requires making major sacrifices and difficult choices. And I know that this has been a tough year for so many, and that we're asking people to persevere as winter draws in. Because the only safe path is to suppress the virus, protecting the economy, education, and the NHS until a vaccine can make us safe. And I commend this statement to the House.
Secretary of State Jonathan Ashworth.
Thank you, Mr. Speaker, and I thank the Secretary of State for advance sight of his statement. Now, Mr. Speaker, in recent weeks, we've had people told to travel hundreds of miles for a test. We've had hundreds of children out of school, unable to get a test. We've had tracers sitting idle, watching Netflix. We've had care home tests taking days to be processed. Yesterday, we had a health minister saying this could be a moment of national pride like the Olympics. We've had a prime minister in a complete muddle over the rules. And now, at one of the most crucial points in this pandemic, we learn that almost 16,000 positive cases went unreported for a week. That means as many as 48,000 contacts not traced and not isolating. Thousands of people blissfully unaware they've been exposed to COVID, potentially spreading this deadly virus at a time when hospital admissions are increasing and we're in the second wave. This isn't just a shambles. It's so much worse than this. And it gives me no comfort to say it, but it's putting lives at risk. And he should apologise when he responds, Mr. Speaker. Now, no doubt he'll complain about my tone or say he won't have any divisive talk, but people want answers. Now, he's just said that over half of the 16,000 people have been spoken to by tracers and presumably handed over their contacts. When will the other 49% be spoken to by contact tracers? How many of the contacts have now been traced and spoken to, and how many are isolating? Why did nobody notice this issue until Friday night? Why did it take until 9:30 on Sunday evening for this to become public? Because clearly the Prime Minister was aware of the problem, because he said on MAR yesterday morning there has been a, quote, failure in the counting system, now rectified. Now, speed is of the essence when dealing with a pandemic. So when were local directors of public health informed? He says this is an ongoing issue, so not rectified, as the Prime Minister said on MAR. When will it be fully resolved? Public Health England sources say they report the data when they get the data from Test and Trace. So can he confirm that data could not be handed over to PHE because of the size of the files, of the Excel spreadsheet files? And was this an issue at one particular Lighthouse lab, or is it across all the Lighthouse labs? And why are critical databases in a national pandemic hosted on Excel spreadsheets? Why aren't they using specialist database software? Now, he likes to boast of his background in software development. So did he sign off this system? Was he aware of it? The Department of Health is responsible for the integrity of Pillar 2 testing data. His department is the data controller. So he is ultimately responsible for this mess. A mess that is made up of the fragmented systems passing data back and forth between his department, PHE, and outsourcing companies like Serco and Deloitte, and it's costing us £12 billion, Mr. Speaker. Surely now is the time to not renew Serco's contract and instead give responsibility and resources to NHS labs and local public health teams to deliver testing and tracing, Mr. Speaker. Now, he says the data does not impact on decisions that have been made about local restrictions, but areas already under restrictions like Bury, Hyndburn, Burnley, Manchester, Liverpool and Newcastle have seen increases as a result of this data. Will areas like these and others under restrictions now be given extra help and resources to battle this virus? And other parts of the country, not under restrictions, are also climbing higher with this new data, such as Newark and Sherwood. So should we expect more local restrictions this week? I notice he says he's bringing in set to bring in a new three-tiered system to replace the confusing network that's in place now. Will he update the House on what the new criteria will be for an area going into restriction and what the criteria will be for leaving restriction? Because so far, it's been a bit like Hotel California. You can check out, but you can never leave. And families deserve answers. Mr. Speaker, the Prime Minister told this House on 20th of May we would have a world-beating system in place by June. It's now October. The system is neither competent nor improving. Problems are getting worse. The government is failing on the basics. When will he finally fix this mess?
Stay.
Well, thank you very much, Mr. Speaker. Just to answer a couple of the factual questions, as I said in the statement, we now have, as of 9 a.m. this morning, 51% of these cases have been contacted by the contact trace system, and their contacts are contacted immediately after that initial contact, so concurrently. The question that he asks about the tiering system, absolutely there'll be extra support that goes to areas where there are an increased number of cases. And he asks about the criteria in this proposed approach. Of course, you can't have a fixed and specific criteria because it depends on the nature of the outbreak. For instance, an outbreak in one individual employer, you wouldn't necessarily then put the whole local area into local action. And so sometimes there has to be, all the time, we try to make the intervention as targeted and as localized as possible. But obviously, sometimes it does need to be broad, as he mentioned, in the Northwest and across large parts of the Northeast. And one example is that the intervention in the West Midlands covers 4 of the 7 council areas of the West Midlands, but not the other 3, because that follows the data. He also asked me about the particular IT system in question. The problem emerged in a PHE legacy system, and we had already decided in July to replace this system, and I commissioned a new data system to replace the legacy one, and the contracts were awarded in August, and the work on the upgrade is already underway. So whilst, of course, we have to immediately change and solve the problem, We also need to make sure we upgrade this system, and we'd already put in place the contracts to ensure that that is happening. In the meantime, of course, it is critical that we work together to fix these issues that were themselves identified by PHE staff working hard late on Friday night. And I want to thank the PHE staff who've done so much working to resolve this issue over the weekend. And of course, in the answer to the final, in 2 days, we managed to get to 51% of them, and that work is ongoing today.
Committee, Jeremy Hunt.
Thank you, Mr. Speaker. The Health Secretary deserves enormous credit for the expansion of testing capacity, which he has personally championed. But isn't the underlying problem here that the Lighthouse laboratories have been overwhelmed by demand and are going to continue to be overwhelmed? And so do we not need to think about the structures, and in particular whether the responsibility for NHS staff testing and care home staff testing should be moved to hospital laboratories and universities in a way that was advocated this morning by Sir David Nicholson, the former Chief Executive of the NHS? Can I urge him to think about whether sometimes it's tempting to think that just by dealing with this latest problem, you're going to solve the whole problem. But this is a situation ahead of winter, ahead of the second wave, when we do need to think about whether these structures are right for what we have to deal with.
Well, the expansion of the NHS testing is, of course, critical as well. And the system in question, where the problem was over this weekend, is a system that brings together the data both from the NHS systems and from the so-called Pillar 2 systems. So that is the challenge was in a system that integrates the two rather than in just on one side or the other. But he makes a broader point, which is that as we expand the NHS's capacity as part of the overall expansion of testing, we have to ensure that we use that capacity to best effect. And many places, many parts of the NHS, increasingly, it's NHS testing capacity that is used for NHS staff testing. And that is a system that works well because the test is local and convenient. And we're looking to expand in exactly the sort of direction that he outlines. But I would urge colleagues away from trying to bifurcate between these two systems. Essentially, we have a whole series of different ways to access a test, and we need to make sure that people get the tests that are the most easy to access for them as much as possible.
Video link. Dr. Philippa Whitford.
Thank you very much, Mr. Deputy Speaker. The delay in almost 16,000 COVID cases being entered into government databases has resulted in last week's case numbers being totally inaccurate. The Secretary of State says the updated statistics would not have led to additional measures, but are there any new areas of heightened concern? PHE have blamed the problem on test result files being too big to load onto their central system. Was this, as has been suggested, due to the transfer of data between formats? And if the underlying issue was due to the rapidly rising number of positive cases, why was this not anticipated or identified sooner? And can he be sure that something like this can't happen again? Just as importantly, it means none of those cases were registered with the tracing system. And while, as he says, people with a positive test got their result, and we hope self-isolated, they didn't get direct advice and they did not give the details of their contacts. From the government's own data, people with COVID report an average of 3 to 4 contacts each. So this would represent 50 to 60,000 contacts who weren't identified, asked to isolate, and therefore will have continued to spread the virus. While up to 10 days has lapsed and the opportunity to prevent onward spread may have been missed, he mentions 51% of cases have been contacted, but what timescale does he hope to reach all the contacts of those cases? And given only about 60% of community contacts in England are currently reached, will he involve local authority public health teams in what is now a massive contact tracing operation?
Thank you very much. Well, to the core of the Honourable Lady's point, the the assessment of the epidemic on the basis of the updated data is core to our approach to tackling the epidemic, and the Chief Medical Officer has analysed that, the new data, which we've now published. So on the coronavirus.data.gov.uk website, you can see the data, and that's on the corrected basis. And based on JBC analysis, the CMO's advice is that the assessment of the disease and of its impact has not substantially changed. And that's because the just under 16,000 cases were essentially evenly spread. So it hasn't changed the shape of the epidemic. It has changed the level in terms of where we're finding the epidemic and in what sorts of groups. She asks about how many contacts have been contacted as opposed to how many of the primary index cases. As I said, that is happening concurrently. So as soon as the index case has been contacted by test and trace and has been interviewed, then the contacts are immediately contacted. And as I say, we've got through 51% of the backlog over the weekend, and we've brought in more resources in order to complete that task.
Ray Clark.
Thank you, Mr. Deputy Speaker. My right honourable friend and everyone in the House hopes that there will be a safe and effective vaccine available during the months ahead. But the head of the vaccines task force has said that she expects it to be available to only half of the population, concentrating on the over 50s and the most vulnerable. Is that the Secretary of State's understanding? And what are the implications for the other half of the population?
Well, this is a very important question, and the Vaccines Task Force has done incredibly important work in supporting the scientific development and manufacture of vaccines, and in procuring vaccines, 6 different types of vaccine from around the world. The work of deploying a vaccine is for my department, working with the NHS and the armed forces, who are helping enormously with the logistical challenge. And we will take the advice on the deployment of the vaccine based on clinical advice from the Joint Committee on Vaccinations and Immunisations. And the chair of the Select Committee will know that 10 days ago, the JCVI published a draft prioritisation, and they will update that as more data becomes clear from the vaccine. That is the government's approach to take clinical advice from the JCVI.
Jeff Smith.
Thank you, Mr. Deputy Speaker. South Manchester, the Secretary of State will know, now has some of the highest infection rates in the country, but the figures are skewed by the very high rate amongst 17 to 21-year-olds, and many of those appear to be students who are confined to halls of residence, and therefore the spread of the virus ought to be contained. So can I ask for an assurance from the Secretary of State that we won't have any extra lockdown local restrictions in Manchester as a result of figures that give a misleading picture of the extent of the virus in the wider community?
Yes, Mr. Deputy Speaker, the honourable member makes a really important point, and this is why I resist the temptation to set a simplistic threshold above which a certain level of action is taken. And that's because there might be an incident. I mentioned there might be an incident in a workplace, for instance. There might be an incident within halls of residence where you might get a very high number of cases, but if it's confined and not in the wider community, you wouldn't want to take action to restrict the social activity of the wider community. So that has to be taken into account, along with the data on the number of cases, the positivity, because the number of tests that you put in affects that as well. And we take all of these things into account, both in asking when an area needs to have more restrictions applied, and when we can take an area out of restrictions, which, of course, is so important for everybody living there.
Sir Bernard Jenkin.
Thank you, Mr. Deputy Speaker. Nobody can possibly doubt my right honourable friend's utter commitment to doing his very best in these circumstances, and indeed the goodwill and hard work of his officials. But this is another incident which further undermines public confidence in the delivery of the government's COVID response. And It is another example of where logistics and planning have let us down. And why can't the government learn from previous successes with the Nightingale hospitals and with PPE, where the military were brought in much more overtly to deal with the logistics and planning and delivery of those programmes, and they should do so on test and trace as well.
Well, of course, they are involved, but this specific issue was in a PHE legacy computer system, which we'd already identified needed replacing, and I'd already commissioned the replacement of, and that replacement is currently being built. So, we knew that this was a system that needed replacing. That work is underway at the same time as the remedial action to of course sort the problem more immediately.
Video link, Stella Creasy.
Thank you, Mr. Deputy Speaker. We have lost a vital week in the fight against the spread of this virus in our country because of a problem with spreadsheets that the Health Secretary tells us they knew about in July. And we are paying £12 billion to these private companies to run this service. And yet the Health Secretary has told us there are no penalties to these companies for poor performance. Who is going to get our money back, Mr. Deputy Speaker? And who is going to take responsibility? Can the Health Secretary tell us where on earth does the buck stop?
Thank you, Mr. Deputy Speaker. Well, of course, I've come to the House to be clear and transparent to the House and to the nation as to the nature of this particular problem. I think it is wrong, though, constantly to be picking on a small number of the many, many cogs in the wheel that we have of this system. As it happens, this particular system was a PHE legacy system. And although that doesn't quite fit the Honourable Lady's narrative, that is the factor of the matter in this case. And I like the Honourable Lady, and she and I have worked together in the past, including on issues like this. She's normally incredibly reasonable and sensible. And I'd be very happy to ensure she gets a full briefing on this one, and any further questions she's got, I'd be very happy to answer.
Oh, that went well. Miriam Kate.
Mr. Deputy Speaker, I want to thank my right honourable friend, his department, and the many thousands of people who've worked so hard throughout the pandemic to make sure that our NHS has not been overwhelmed. But an inevitable consequence of this is that a large number of elective operations have been delayed, including joint replacement surgery. And sadly, this means many people, including some of my own constituents, are living in severe pain whilst waiting for procedures. So I wonder if my right honourable friend could set out the NHS's plan to make sure people get this life-changing surgery as quickly as possible, and could some of the welcome additional resource that's been announced be used for some post-op rehabilitation?
The short answer, Mr. Deputy Speaker, is yes, and my honourable friend makes a really important case. The restart of the elective operations within the NHS is now proceeding apace. Of course, the more we can keep the virus under control, the easier that restart is. But in any case, the NHS has done a huge amount of work over the summer to try as much as is possible to separate the NHS into what are called COVID green areas, where we have a high degree of confidence there isn't any coronavirus, and COVID blue areas where there may be, so that people can get the long-term elective work done that's needed, and that will include an expansion to rehabilitation. She might have seen that one of the list of 40 hospitals that the Prime Minister announced was the DNRC, which is the National Rehabilitation Centre to be built just outside Loughborough.
Video link, Andrew Gwynn.
Yet we've now got some of the highest...
Andrew, can you hear me?
I can hear you.
Please start the question again.
The majority of Greater Manchester has been under local restrictions now for over 2 months, yet we've now got some of the highest rates in England. The test and trace debacle once again shows that the national system is broken and his measures aren't working. He knows the Greater Manchester authorities are keen to adopt a more localised approach. So if the newspaper reports are right that we're going to get a new tier system, Isn't this the right time for the government to give local areas the control over test and trace systems supported by extra financial resources?
Thank you very much, Mr. Deputy Speaker. Well, I half agree with the honourable gentleman. It is important that we put more testing resources into the areas where cases are high, and it is very, very important that we continue to strengthen the local engagement with the national system. And I was talking to the Mayor of Greater Manchester about this only this morning. The challenge is that you also need the scale of the national system so that where there's an outbreak, you can bring huge amounts of resources to bear and make sure we can really target the support, for instance, for contact tracing. So it's the combination of the local and the national that's going to get us through this.
James Davis.
Thank you, Mr. Deputy Speaker. Since Thursday of last week, under Welsh Government local lockdown measures, 500,000 people in North Wales have not been allowed to cross often meaningless county council boundaries without good reason to do so. This is causing huge disruption to livelihoods and well-being. So will my right honourable friend outline his understanding of the scientific evidence for restrictions on travel such as this?
Well, my honourable friend raises a very important question, which I know is exercising people who live within North Wales and on the border. I'm not going to criticise the Welsh Government with whom we work closely, but I would say that in England, when we choose to bring in measures restricting travel, we do it with strong guidance at the moment rather than within the law. And part of the reason for that is that there are all sorts of reasons that people might need to undertake a journey. So even where we advise people to minimise unnecessary travel, we do that by guidance, and by the large part, people follow it.
Patrick Grady.
Thank you, Mr. Speaker. Mr. Deputy Speaker, the First Minister said on Friday that work was underway to improve the interoperability of the two test and trace apps, and I wonder if, because they don't both work at the same time, as I've found out to my own experience, so I wonder if you can say a little bit more about how discussion between the Scottish and UK governments is progressing, and if there's some sort of timescale for allowing the two apps to work together.
Yes, I'm delighted to have the chance to agree wholeheartedly with the First Minister of Scotland. We've been working closely together to make sure that the apps in different parts of the United Kingdom work together and interoperate. That upgrade is expected in the coming weeks. We're working on it very hard and very constructively between the two different governments.
Andrew Mitchell. Mr. Deputy Speaker, may I thank my right honourable friend for the way he has worked so closely with us in the West Midlands. He knows that I'm in favour of community solidarity and good sense, first and foremost, rather than legal diktat and government fiat. And when he commend those universities who have already introduced student responsibility agreements as a way of furthering all of that. And will he bear in mind this week, later on this week, that our highly effective Mayor, Andy Street in the West Midlands, the Labour leader of Birmingham City Council, and I are all of one mind, together with Justin Varney, the excellent head of public health in Birmingham, that the current level of infection rates mean there should be no further changes there this week.
Well, thank you very much, Mr. Deputy Speaker. I concur with him on the importance of personal responsibility, that we all have a responsibility in this virus. I hadn't heard of responsibility agreements with students, but I think that is a very sensible approach. I spoke to Andy Street this morning, and he made clear to me the need to work together, national and local government, which is working very effectively across the West Midlands, across party lines, exactly as my right honourable friend says. And we must continue to do that as we monitor the developments and monitor the data and do all we can to keep this virus under control.
Munira Wilson.
Thank you, Mr. Deputy Speaker. Some local authorities are reporting that up to 500 unexpected positive cases have been downloaded to their system. Some are 2 weeks old and have had no contact at all from the national system. Directors of Public Health are angry and they're frustrated about the lack of joined-up working and the fact that the national system continues to break, despite his and Baroness Harding's promises to go for a more locally led approach. So when will he start to work better with local authorities and have a more joined-up approach, harnessing their expertise?
That's exactly what we're doing, absolutely. And for instance, this morning I also spoke to Sadiq Khan, the Mayor of London, about how we continue to strengthen the join-up between the national and local approaches. I entirely agree with her that it's incredibly important.
Dr. Luke Evans. Thank you, Deputy Speaker. Until we get a vaccine, the House knows that it's following the rules of hands, face, space and get a test. But my right honourable friend will also know that there are different types of tests out there. So I'd like him to comment on the plans for future testing and what updates he might have. We've heard talk about salivary testing, finger prick testing, all that possibly may allow individuals to be able to deal with COVID themselves. Thank you.
Yes. We're doing a huge amount of work to trial these next generation tests at the same time as expanding the current testing capability. For instance, wouldn't it be easier if you have to have a test, Mr. Speaker, if you just need some of your saliva rather than to have to put the swab all the way up your nose and down the back of your throat? These sorts of improvements in technology are in the pipeline, and we're working incredibly hard to bring them to bear as soon as possible.
Liz Twist.
Thank you, Mr. Deputy Speaker. The local authorities in the North East have put forward a proposal to be able to provide a test and trace service regionally. After this latest fiasco, will he now agree to pick up that offer of local testing and tracing and fund the local authorities in the North East to provide this?
We put an extra £10 million to the local authorities in the North East to support the contact tracing, and we also are stitching together the data feeds between the national system and each of the individual local authorities in the North East, and it's a project that we'll keep working hard on, and I'll keep listening to the needs of the local authorities in the North East and across the rest of the country.
Neil O'Brien.
Thank you, Mr. Deputy Speaker. It's good that we are now testing more than other countries, and it's good that we've got a quarter more testing capacity than we did in August. And we're very grateful to the staff of the mobile testing centres that we now have in Erdby and Wigston. But what is my right honourable friend doing to further drive up testing capacity so that we can stay ahead of this?
Well, that is the subject of a huge amount of government effort and working with the NHS, working with the private sector, both on the current technology and the new technology. Mr. Deputy Speaker, I just make a point about Erdby and Wigston in my honourable friend's constituency. People often, people say, where is a local lockdown having an effect? Well, the answer is Erdby and Wigston, where the case rate has come down because the good people of Erdby and Wigston have followed the locally applied rules, and it's brought the virus back under control. And I'm very grateful to my honourable friend for the leadership that he's shown there, along with the leader of the county council and of the district council, who worked really hard together to make this happen.
Karen Buck.
Mr. Deputy Speaker, despite all of the billions that have been spent on testing, we learned at the end of last week that the testing levels in London fell by 43% on the week before. There is also a staggering variation in capacity. In my own borough, Westminster has one of the lowest testing rates in London. Given that the limited testing capacity means that it is being directed to those with the highest rates of infection, isn't there a very real risk that this will mean we don't know what is going on accurately across the country because areas that are not getting enough testing are not showing transmission, therefore we can't make good decisions? When will we have the testing capacity to allow us to make the right decisions for our people and our economy?
Yes, the honourable lady makes a really important case. Firstly, as she implied in a question, of course we have to put the testing capacity into the areas of the biggest outbreaks to tackle those outbreaks. And I think everybody understands that. At the same time, we've got to increase testing capacity, and we're doing that. But the third point is, if an area has lower testing than another area, we have to make sure that we take that into account when you look at how serious the problem is. And we do that in two ways. The first is the positivity rate, so what proportion of tests come through positive. And the second is the survey data, and in particular the ONS survey, which shows that rates in London are higher than some parts of the rest of the country, like the southwest, the southeast, and East Anglia, but not as high as in the Midlands and the north of England, or indeed Scotland, Wales, and Northern Ireland. So we've got to look at the surveys, we've got to look at the positivity, as well as, of course, the basic case rate.
Aline Cairns.
Thank you, Mr. Deputy Speaker. can I recognise my right honourable friend's focus and attention and efforts in relation to responding to the ever-changing COVID situation? And in this, does he recognise that there are currently a myriad of different forms of restrictions across the different parts of the country that can become confusing? Therefore, what consideration has he given to simplifying the approach to the restrictions? And in doing so, would he ensure that any simplification applies to every part of the UK?
The short answer is yes. I think that the proposals that we are working through and that I'll bring to this House, Mr. Deputy Speaker, to have a more simplified approach to the local action that's needed. We have shared that approach with the devolved administrations, and indeed I've discussed it with Vaughan Gething, my opposite number in Wales, and it is the sort of approach that would simplify further were it undertaken across the UK. But of course, that's a decision for the Welsh Government in Wales and for the devolves, because public health decisions are devolved. But I would urge the Welsh Government to work, well, they are working with us, and I'd urge my right honourable friend, who's a very strong voice in Wales, to try to persuade the Welsh Government to take that sort of approach right across the whole of the Principality.
Jonathan Edwards.
Diolch, Mr. Deputy Speaker. Increasing evidence indicates that so-called long COVID is impacting around 10% of those contracting the virus. So what assessments have been undertaken on the potential long-term social and economic impacts of long COVID, as well as lasting pressures on health and care systems?
Mr. Deputy Speaker, we have three Voices of Wales in a row, and including you, sir. And I couldn't agree with the honourable gentleman from Plaid Cymru more. The impact of long COVID can be very debilitating for people for many, many months. And some people who caught COVID in the initial peak still suffer from long COVID symptoms. And we have instituted more research. We've started in England, at least, a long COVID service within the NHS. And just today, the National Institute of Clinical Excellence has published an approach to assessing long COVID, which I would recommend to him. That is an approach that clearly is going to need continued effort so that we can make sure that people who suffer from long COVID get the support that they need.
Cat Smith.
Thank you, Mr. Deputy Speaker. On Friday, I and my constituents learned via the local media and press reports that there are government plans to close the hospitals in both Lancaster and Preston, with plans to replace them with a super hospital, which would have obvious implications for other Lancashire hospitals like Chorley and Blackpool Victoria hospitals. Because closing 2 hospitals in Lancashire to build 1 super hospital does not make it easier for my constituents or the people of Lancashire to be able to access vital medical care. So can I ask the Secretary of State if he believes, as I do, that next time we hear a government minister talk about building 40 new hospitals, it should come with a health warning that that also means closing 80 hospitals?
I invite the Secretary of State to answer that, and I'm going to give some flexibility. Please, could you make sure that your questions relate to the statement that has just been given? Secretary of State.
As well as responding to coronavirus, Mr. Deputy Speaker, we also need to ensure that we invest in the physical infrastructure of the NHS. And I would just correct the Honourable Lady, because the proposal in her part of the world is to consult on whether 1 or 2 hospitals are the right approach and the right thing for her part of the world. And I would encourage her to welcome the massive investment in the NHS in Lancashire, as across the country, which is going to improve care right across this land.
Thank you, Mr. Deputy Speaker. I'd like to thank my right honourable friend for the huge investment in West London hospitals announced on Friday. But can I ask, with regards to coronavirus, should we not focus as much, if not more so, on the hospitalisation rate as opposed to the incidence rate, since often people do not have symptoms or have very mild symptoms, and certainly in London the hospitalisation rate is a fraction of what it was in April.
Mr. Deputy Speaker, of course, the hospitalisation rate is a very important factor that we look at, and it's a concern. Unfortunately, the latest hospitalisation rate has risen to 422, which is the highest since the middle of June. Of course, hospitalisations tend to lag the number of cases because people catch the disease and then are, sadly, some of them are later hospitalised. So we keep a very close eye on the hospitalisation rate. The bad news is that it is sadly going up.
Video link. Bill Esterson.
The 6 councils in the Liverpool City region face a budget shortfall of £150 million. On Thursday, the Health Secretary announced £7 million to be split between the Liverpool City region and 3 further councils. It is a drop in the ocean compared to £150 million. The Health Secretary knows that local professionals have solutions to the problems of test, trace and isolate. He's shown there's not just millions of pounds, but billions available for Serco, Deloitte, Compass and friends. So when will he invest in local public health teams and sort out the mess of test, trace and isolate once and for all?
Thank you, Mr. Deputy Speaker. As I said, we have been putting that extra money into local councils as well as using all sorts of, frankly, all the tools at our disposal, public or private sector. If you're in the NHS, in PHE, in a local council, or a firm that can bring capability to bear on this problem, and it's one big team effort.
Selwood.
Mr. Deputy Speaker, talking of tools at the right honourable friend's disposal, Bournemouth University stands ready to help with lab testing, but it's COVID testing in schools that I would like to address, because today the rules state that entire year groups must stay out of school for 14 days if one of the pupils in that year group tests positive. And of course, this causes huge disruption, not only to learning, but also to working parents who have to provide childcare. So could I ask the Secretary of State, with better testing systems now in place, please, can we review this 14-day rule that sends an entire year group home so we can both keep our children safe, but also in school?
I would love to be able to review that, but only when it's clinically safe to do so. But I would just point out, both to my right honourable friend and also to all of those in education and in schools across Bournemouth who are following this, that you do not necessarily have to send the whole year group home. You have to send the bubble home, and you can, by ensuring that the way that the school operates, keeps people safe, you can ensure that bubbles are smaller than the whole year group, and many schools do that. So I think the first port of call immediately would be to try to get the bubbles smaller within the school, and then of course, absolutely, we should work together on other ways to solve the problem.
Robbie Moore.
Thank you, Mr. Deputy Speaker. I do not underestimate the scale of the challenge in ensuring we have enough tests for everyone who needs it. And it's incredibly encouraging that testing capacity has increased by 25% since the middle of August. So can my right honourable friend assure me that he continues to work to get that testing capacity up even further so that venues like Victoria Hall in Keighley can meet demand?
Yes, absolutely right. The testing capacity now stands at over 300,000. We're on track to reach 500,000 by the end of this month. I know what a goal for expansion of testing capacity feels like. This is a tough and difficult challenge, but the team are rising to it. And Mr. Deputy Speaker, I'd just say that within Keighley, my honourable friend has really made the case for Keighley so strongly during this pandemic, and he continues to make it in terms of the extra testing capacity that's needed there now.
Alison McGowan.
Thank you, Mr. Deputy Speaker. However basic this data error may have been, the consequences are very serious. But I want to say to those civil servants working night and day to get this right, the responsibility for this is not on you. It is on those who guarantee the checks to the system. As the Secretary of State has indicated, that is him. So with that in mind, can he avail himself of any data process flowcharts or other diagrams relating to the processing of this data and all data quality assurance policies and processes and put those in the public domain, yes or no?
Well, I'm very happy to work with the team to see what we can put in the public domain. The challenge of a maximum file size error is that it wouldn't necessarily have appeared on one of those sorts of flowcharts, itself, given the massive expansion of the availability of data storage over recent years, would not, I would expect, be a feature of the replacement system that we're already in train to bring in to replace the system that caused the problem this weekend. But I would just wholeheartedly agree with what she said about the civil servants in the department and staff at PHE who are working so hard during this pandemic.
Wigan.
My honourable friend gave an excellent answer to the honourable member for Tunbridge Wells. The JCVI report is indeed most helpful and reassuring because it prioritises the vulnerable, the elderly, and of course our health workers. However, it last met on the 1st of September and the report is dated the 25th of September. Can he confirm that if there is more information on the progress of the vaccine, that committee will meet again and we'll get another excellent report?
Yes, absolutely. When people are asking questions about how the vaccine will be rolled out, and of course I understand why people are so interested in that, we will, of course, protect the most vulnerable first, and we'll do that on the basis of clinical advice, and the JCVI brings together the best clinicians in this area. Of course, it meets very regularly, and decisions of the JCVI will not be on the critical path to the rollout of the vaccine. I've been assured of that.
Video link. Debbie Abrahams.
Thank you, Mr. Deputy Speaker. One of my 15-year-old constituents had a COVID test over a week ago, and in spite of chasing, is still none the wiser as to whether she has COVID or not. Not only is she having to self-isolate, but her mum, a nurse, is also having to take the precaution of self-isolating, something she says her ward can ill afford. On top of this, Mr. Deputy Speaker, last month, the time taken to get test results back from the National Test and Trace Programme, the Oldham's public health team, to enable them to trace the cases the national programme is failing to get in touch with, was 12 days. 12 days, not 24 hours. So will the Health Secretary please tell my constituents how many of the 16,000 or so lost test results were from Oldham, and how many contacts, not cases, have not yet been traced?
Thank you very much, Mr. Deputy Speaker. Well, of course, the good news is that the turnaround time of test results has been coming down. I'd love to see to take up the case of the individual who hasn't had a result back as she described, because that is rare. The majority of cases come back now the next day, and that's good news. I'll specifically be looking to turnaround times in Oldham because an average of 12 days seems a lot longer than I expected, and I'll make sure I get back to the honourable lady at the appropriate opportunity.
Croft.
Thank you, Mr. Deputy Speaker. Speaking to local people, it has become clear that there are still concerns about routine appointments, GP appointments, and increasingly routine dental care as well, which is obviously really important to prevent future problems down the line. Can my right honourable friend tell me what plans he has over these potentially bumpy next few months to ensure people are still able to get those appointments?
Yes, well, for all my enthusiasm for technology, and that enthusiasm is huge, the need for people to have a face-to-face appointment with their in primary care at their GP surgery, if that's needed, is obviously critical. And every GP practice should, of course, offer those face-to-face appointments where they're needed in a COVID-secure way. We've made that clear. The vast majority of GPs are doing incredible work and offering the public the service and the vocation that they went into medicine for. If my honourable friend has specific examples, I'd be very happy to look into them. But overall, it's so important that we keep primary care running.
Video link. Barry Sherman.
Mr. Speaker, my former student, thank you. could I say to the Secretary of State that we're talking about human beings here, working systems, and I warn him that there will be more glitches. Technology means glitches. So I'm worried about him because we've got a long, hard winter. Can I ask him, does he agree with me that what we're doing in Huddersfield and Kirklees is working together as a council, as a local university, as a local health trust, working together, putting party political issues to one side. This is what we must do this winter. A long, hard winter. We've got to beat this virus. We've got to work together in order to do that.
I agree with every word that my honourable friend said.
Aaron Bell.
Thank you, Mr. Deputy Speaker. Firstly, could I welcome the new centre at Keele University campus in my constituency, which opened last Friday, and thank his department for that. But secondly, he may be aware of the article in the Times on Saturday suggesting people were having difficulty accessing tests in the centre in Newcastle-under-Lyme itself, which had been walk-up in August but now requires booking. The article suggests there's plenty of capacity at the centre, but there's not yet enough at the labs. So could he confirm this government is still committed to 500,000 tests per day by the end of this month?
Mr. Deputy Speaker, we're committed and on track to the delivery of 500,000 tests by the end of this month. We have capacity at over 300,000 now. I saw the article in the Times newspaper. Of course, one of the good things is that in Newcastle-under-Lyme, the case rate had come right down, which meant that we had a walk-in centre because it was an outbreak area, and it stopped being an outbreak area because everybody in Newcastle-under-Lyme did their bit and brought the case rate down. And so that's a good thing, of course, but it does mean that we have to make sure that the testing is targeted at where it's most needed across the country. But what I really want to do is have that extra capacity that we're building so everybody everywhere can get it.
Video link, Barbara Keeley.
Thank you, Mr. Deputy Speaker. In Salford, the case numbers have now risen above 250 per 100,000. As well as this case uploads programme issue today, our local contact tracing programme is having to wait on average 4 days for data from the national system, and in the worst cases, 7 to 9 days. Now, that's creating an unacceptable delay to contact tracing. In August, Baroness Harding said that we would have a contact tracing system which was local by default. So what is he doing to make sure that data gets to local authorities in a timely way so that they can be followed up by genuinely local contact tracing systems under the control of our local directors of public health?
This is the goal as she sets out, and reducing the times for those transfers is very important. And making sure that the transfers happen effectively and in an automated and cohesive way is very important. But the approach that she sets out of using the national system to to do the first attempts at contacting people, contact those who it's easy to contact, and then use the local system to contact those where it's more difficult, where the boots on the ground can help. That's the approach that we're taking to make sure that we can get that join up as effectively as possible.
Jane Stevenson.
Thank you, Mr. Deputy Speaker. I'd like to thank the Secretary of State for working so constructively with Wolverhampton City Council when they requested some limited local restrictions around households visiting other households in their own homes. As we move forward to get the virus down, can we give further advice on how we all can limit transmissions within home settings, especially where we have a vulnerable family member?
It is so important that people follow this guidance. And of course, the first principle for everybody needs to be hands, face, space. And keeping a distance, if possible, within households if somebody tests positive. And the other thing not to underestimate is the importance of cleaning, because this virus passes on through the air, but it also passes on surfaces, and we should all be aware of that.
Video link, Dan Jarvis.
Thank you, Mr. Deputy Speaker. It was good to see the Secretary of State earlier today, and I very much hope that he'll keep talking to local and regional leaders. As the Secretary of State well knows, the winter months are always the toughest for patients and for staff. This one could prove to be the most challenging that our NHS has ever faced. So can I ask the Secretary of State to guarantee that the NHS will have the funding and resources needed to get it through this winter?
Well, I welcome the very constructive approach that the honourable gentleman takes in his local role, as well as in this House. And of course, we've put in the extra funding that the NHS needs this winter. We're expanding over 140 emergency departments, because emergency departments need more space, so there could be social distancing. We've also put in funding so that we can continue the work on electives, even though it's more difficult, and on infection control, and of course, as much discussed, on testing. And I look forward very much to working with him further as we try to control this virus.
Salute. Can the Secretary of State confirm that the rule of six and curfew are based on the evidence of what worked in Belgium? And will he continue to provide the whole country with the evidence of what has worked internationally, so we can take the whole country with us to defeat the pandemic?
My honourable friend makes a very important point, which is we've got to learn from things that have worked in other countries. We're constantly looking around the world, as well as at the domestic science. And I'm very happy to work with him to see what